small amount of money within the budget. And I mean, if you look at, other deputies here have suggested ways in which the money could be found. Several people have already suggested we do not need all of the ministers for state that we have. That's one place where you could immediately find a saving that would considerably contribute to this. The consultancies, the variety of consultancies that the HSE uses, they have farmed out a number of jobs that could well be done within the HSE, including the writing of letters to all of those unfortunate patients in the North East who had to have their x-rays reviewed, and including the nursing home repayment scheme, which I think cost 15 million to a private company in terms of administering that particular scheme. So there are lots of ways in which that money could be found. And I have to question, how on earth, Minister, do you do your prioritisation if this is not a priority? If this life-saving, preventative measure that would bring much better health outcomes to women into the future is not prioritised. And I'm not for a minute suggesting that you should take it from the cancer control programme, or from the rollout of cervical screening, or from the rollout of breast check, which hasn't yet been completed. They are not the kind of programmes that it should be taken from. It should be taken from things like consultancies, things like bonuses, things like extra ministers, things like farming out to the private sector work that could well be done within the very large numbers of people who work both within the HSE and within your own department, Minister, which has only lost a handful of people since the HSE was set up. So with some bit of will and some bit of imagination, it is quite possible to find that money and to reintroduce that programme. And I just want to briefly, Last Corla, I just want to talk about the money, because the Minister suggested this morning that it was going to cost 14 million euros. Now, she based that on multiplying 24,000 by 600. And it's the 600 that I want to question, because in the HICWA document published in February of this year, their suggestion is that it would be 100 euros per dose, and that if it was a school-based programme, which is what the Minister is suggesting, the administrative fee would be 30 euros. So that comes to something much closer to 10 million than to 14 million. So I would ask the Minister to address that and go back and look at it in that context, that if it's done in the schools, which is what you want to do, and if it's done with those kinds of figures, and incidentally, because there is competition among the companies that produce the vaccine, it should well be possible to negotiate a price that might even be below this 100 euro figure. So, I mean, there is, with the will, and I'm afraid that what's lacking here is the political will, but with the political will, you could do it in a reasonable price, and you could find the savings in a variety of ways. And I just want to stress as well, Lascian Corla, that just after this was announced, I spoke to a mother of a young girl who is approaching 12, and she had already explained to her daughter that this was going to happen. And mothers like her now have to go back and explain to their daughter, I'm sorry, I did tell you that you were going to get a vaccine, and I was, and it's difficult enough to explain it to a 12-year-old, but I did tell you that you were going to get this vaccine, and how important it is, because for the future you are going to be prevented from getting, or at least helped in the prevention of a disease that has serious consequences. And now they have to go back to their daughters and say, well, I'm sorry, you're 12 this year, but you'll be 13 or 14 or 15 by the time this comes in, and you won't get it. So I just again would urge the Minister, because of the relatively small amount of money, because of the huge value of this programme, and because of the fact that despite our recessionary times, that we are a relatively rich and developed country, and we should be able to find the wherewithal to introduce such positive programmes that have such positive results for future generations.